Hi, everyone. Welcome to Resolve's Kitchen Table Conversations. We are so excited to have you here for this conversation, which is a topic that comes up all the time. And I am really excited to be able to have this conversation to give you content and information that you're going to need. So we are sitting around our virtual kitchen table. This is a nod to Resolve's founder. Her name is Barbara Eck, and she founded Resolve around her kitchen table. So as you can see, I'm in my virtual kitchen here, and I am very, very excited to have you with us. All right, we are going to have a conversation today about how to understand your medication benefits, how to access the medications that you need, whether that's through health insurance or paying out of pocket. And we have an expert, and I'm very pleased that we have this expert with us today with Walgreens Pharmacy. And also this kitchen table conversation is sponsored by our head of the table sponsor, Walgreens Specialty Pharmacy. So Brianna Standke, I am so excited to have you here. Hello.
Hi, thanks for having me. I'm very excited to be here.
Well, this is a real treat for our viewers because they have two Minnesotans right here, native Minnesotans, on today. I am actually not in Minnesota. You, you are,
I
and we've
am.
already shared where we went to high school and where we grew up and what street I lived on. It turns out, Brianna, your husband and me are from the same town, and we went to
Yeah.
rival high schools, just a few decades different, but that's okay. So Brianna, I'm so excited to have you here. You've been with Walgreens since 2010. You
Yeah.
left this great state of Minnesota to go to college in Iowa, and you are what's called a PharmD. You're not just a pharmacist, you're a PharmD. What is a PharmD?
It's basically just a doctorate of pharmacy. The profession went from kind of a master's or just a typical bachelor's degree back a long time ago. And now we get a doctorate of pharmacy, which is what most pharmacists, well, all pharmacists will graduate with now.
There you go. Wonderful. Well, you work in Walgreens Specialty Pharmacy. You're an expert on the fertility medications. Explain to me what a specialty pharmacy is. Why do we even call it that?
So, specialty pharmacies carry medications that your typical retail pharmacy might not carry. They're higher dollar amount medications, typically require prior authorizations or more legwork to get them covered by insurance if they're covered at all. So, we kind of take more time to be able to bill those things, and they require more specific counseling and more specific just information to give to the patients. And we kind of really hone in on those specific medications. And my specific specialty would be the fertility medication side of things.
Are there other, give me an example of another area where specialty medications are, or medications are handled by a specialty pharmacy?
Sure. A lot of biologics that are used for hepatitis, or I mean, HIV is a big one.
Got it. Okay.
Yeah. Mhm.
Great. Okay. So here you are in the fertility medication space. You get to deal with a lot of probably physicians as well as a lot of patients. So we're going to break this conversation down in a couple of categories because I'm so excited to have your advice. And really what we want to do, Brianna, is we want to give people those tips and advice. So we want to talk about people who have insurance for their fertility medications. And then we want to talk about people who have to pay out of pocket. In other words, their health insurance is not covering the fertility medications. And so we want to give both of those audiences some really valuable information. So let's start with those folks whose health insurance includes fertility medications, and they're just kind of at a loss trying to figure out how to navigate this. Tell us what advice you have for people who are trying to navigate and wade through their benefits.
Yeah. So unfortunately, it's not very intuitive. There's a lot of hoops you have to jump through, red tape, and there's no one easy way to find that information. I found the best suggestion I have for patients is to call their insurance right away at the very beginning. And they can at least give you a starting point and say, this is how much you might have towards your fertility benefit. This is where you might have to go or what specific pharmacy you might have to use, because a lot of insurances will contract with maybe a couple different specific specialty pharmacies if you do want to use your benefits for medications, and then you'd need to go through there in order to be able to use your benefits. A lot of patients don't necessarily realize that, and they think any specialty pharmacy can fill, and they can use their benefits. So that's really important to start with.
So it's so depending on who their insurer is, they might,
Mhm.
what you're saying is they might actually tell their the folks on their insurance plan where you have to go in terms
Yeah,
of the pharmacy, and it's not going to be your pharmacy probably down the street. It's probably
no,
going to be the specialty pharmacy arm of that particular pharmacy. Okay.
correct.
So
Yep.
so are there any questions that that you think people forget to ask when they're on the phone with their insurance company? Like, and they by the time they get to you, you're like, do you know this? Do you know that? And they're like, oh, I never asked that.
Most specifically, I would say they forget to ask about potential, how would I say this? Like limitations, I guess. Like
Mm,
how much do I have towards this benefit, specifically, or how is that calculated? Is it used for my medical expenses as well as my pharmacy expenses, or are they separate buckets? Or are there specific medications that are needed that might need prior authorizations? So they might be covered, but they might need prior authorizations, which means that the doctor or the clinic specifically needs to fill out additional paperwork to get those medications covered. The insurance will kind of review what the doctor says, why they're needed, and then make a decision on whether they will be covered or not at that point.
got it. So you said something that that I think a lot of people don't realize. With an IVF benefit or even medications, many of the plans that we see are designed in a dollar cap fashion. This means that instead of saying, hey, your IVF cycles are covered, your medications are covered, you can do 3 cycles of IVF or however many, they actually say infertility or your fertility benefit is a max of $20,000 or $10,000.
Mm-hmm.
And so the patient is like, well, I don't know how much all of this costs. What do I do with that? Um, are you seeing any strategies that work really well in terms of managing the medication and your medical expenses with this, like, if you will, a budget? You're almost like you
Mm-hmm.
have a budget and you can't go over that, or else
Yeah,
you're paying out of pocket.
right. It is a budget. And unfortunately, those budgets don't go very far on either the medical or the pharmacy side. Most often, we have a couple specific health plans that either have a 3, 5, or $10,000 max is what we see most often, and those hardly cover even one single prescription. So usually, I tell patients, once they find out if that bucket is all inclusive of medical and pharmacy, it usually makes most sense to use that money towards their medical side of things, procedures, office visits, lab visits, whatever it may be. We have many different discounts from manufacturers that oftentimes will bring those out-of-pocket costs cheaper than what insurance copays would be anyway.
What? Yeah,
Yeah. So
this is, if you're listening to this, this is it. You just got the most amazing piece of advice. So
Yeah,
let's recap.
it's wild.
When you have that dollar cap benefit and you've checked and they've said, yeah, that's for everything. That's for, and I loved how you said it, the medical and the pharmacy benefit.
Yes.
It's going to be better because what you're telling me is if they're paying out of pocket through the pharmacy, there's more programs to lower that cost. It's really hard to go to the reproductive endocrinologist and fertility clinic and the lab and start negotiating, lowering all of those costs to get into that budget. So
Yeah.
Brianna, do you see that people know to do that in advance, or is this something that that they're learning? How do people find out to do that?
So we really do our best at Walgreens to really make that transparent with patients. And I mean, there are, I will say, a lot of patients who don't even have any coverage available to them. And so then we automatically are giving them those discount pricing and making those available. If they do happen to have a fertility benefit, we really try to spell that out for them and say, hey, this is available to you through your insurance. However, really you might want to consider, talking to the clinic and figuring out, they're trying to figure out how much the medical side of things will cost. And then we can give you what our discount pricing would be through these manufacturer discount coupons, which they don't need to do anything to apply for these discounts we have automatically. There are additional programs that patients can apply for, but we automatically apply these manufacturer discounts right away if they choose to use them versus their insurance.
Yeah, this is, Brianna, I've known this, and this is something that I hear all the time. And, at Resolve, we do not like dollar cap benefits at all. When we go forward in asking for insurance coverage from employers, and if we're looking at a state mandate, we are never advocating for these dollar cap benefits. It's just really hard.
It's really restrictive. Yeah.
It's very restrictive, but they exist. And so it's really amazing to know that on the pharmacy side, you need to ask, and it sounds to me that Walgreens, you are actually being very proactive and letting patients know that. And I'm sure other pharmacies do the same, but it's important for you as the patient to know this, to know that you have choices and you have options. And you want to maximize every dollar that you have in front of you. And this is an incredibly, incredibly good way to do that. Anything else on the side of folks that have a benefit? Is there any other, and then we're going to move to the ones that have to pay out of pocket.
Sure. Really the biggest thing is just being diligent about keeping receipts and knowing how much you've spent and what's been covered and what hasn't been. We've heard of a lot of cases where insurance companies have made mistakes and got it wrong, or something wasn't counted towards a max, or something was counted towards a max that shouldn't have been, or specific procedures should have been covered and weren't. Or it's just really important to be diligent about, and advocate for your own healthcare and your own money. You're spending lots and lots of money. So you need to just be aware, honestly, is what I would say.
So let's move to patients that their employer doesn't have any insurance coverage, or perhaps they're in the military. They're having to pay pretty much out of pocket for their medical and their pharmacy benefit. What can you tell us again about how they can access the benefit, and how does Walgreens and pharmacies in general help?
Sure. Most pharmacies, well, I'll speak for Walgreens, obviously, but we have specific contracts with manufacturers, Organon, Ferring, Serono, which are three of the main manufacturers of a lot of these big dollar amount medications. And we have these manufacturer discounts that significantly reduce the costs of a lot of these medications. We always are very upfront with this. We have patients call all the time just looking for pricing. They're calling around to different pharmacies trying to
Wow.
figure out the best pricing for each specific medication, which is also a great idea. And we will lay that out for them. I always try to ask, are you an active military member? Because there are specific programs you can apply for. One of them being through Reunite, which is one of the manufacturers of a few of the big medications, Canarelix, Follistim, Pregnol. There are also programs that are based on income that patients can apply for, in addition to what our discount programs are. So that would take off additional cost
Wow.
from our already discounted prices. So really, I guess the biggest thing is just to be upfront about your own specific situation and make sure you are telling, any pharmacy, hey, I'm military, or my spouse is active military, or, I was an oncology patient at one point, or, are there any income-based programs I can apply for? And just make sure that you are being upfront with your situation. There's another program for women who are undergoing elective egg freezing cycles,
Oh,
which
okay.
is happening a lot right now, just with the, more women in the workforce and waiting to have a family.
Yep.
So that's also something to look into. I think that's about everything, but the point is there's a lot of options out there to help decrease that out-of-pocket cost.
That's fantastic. Moving on to just a couple general questions. Just curious, with the patients you see, these are patients who are getting fertility medications. Is there a question that's the most common question that you get that we can answer today for patients?
Oh,
On any topic
yeah,
related to their medications.
yeah. I think the most common thing I get is, can you do the injections for me? Honestly.
And what do you say?
We can't as of now. It's a legal thing, unfortunately, but there are resources out there. There are nurses that can come to your house and do them. I know we would love to be able to, and we're potentially trying to figure something out in the future for that. But honestly, that's probably the biggest one. We also
Yeah.
have patients ask if they can like finance their medications. There's a lot of times when they're coming into the pharmacy to pick up their full order, it can be anywhere from $3,000 to $6,000 at that one
Wow.
point. But so I guess that would be another thing. And there are financing options out there, loan programs that people can apply for as well, specifically for medication loans. Yeah, I guess those are the two biggest things.
Yeah. So, Brianna, you and I got a chance to chat for a little bit before you jumped on. Tell me why you like your job.
Oh, it's very gratifying. Technically, infertility is considered a disease state. So I don't know. I refer to it as a proactive disease state where people are wanting to be on these medications. They're wanting to be compliant. They are some of the best patients to work with because they are motivated. And we get to build relationships with them. They're coming in, we're talking to them before they even come in to get their medications, and kind of build that background relationship. And then sometimes they're coming in daily for refills of medications,
Yeah.
through that STIM portion. So we kind of get to check in on them and see them. And then to see the success stories, once we get to the portion where they're getting medications for the, post-implantation portion of it, it's just really cool to be able to spend time and talk with those patients and really get to know them. It's just a very rewarding specialty to be in.
It's interesting to me. I want to make sure that people who are listening feel that their pharmacist and their pharmacy are part of their team, because we always talk about the doctor and the nurses and the embryologist, but you all are part of that incredible team, that support system as well for these patients. And I loved how you just described that. I know that for those of you who are listening to this, here's the key takeaway messages that we've shared. Talk to your pharmacy, talk to your insurance company, understand if the pharmacy and the medication benefits are different or if they're lumped together. Either way, when you get to the pharmacy, ask them how you can maximize your dollars and make sure that that you are availing yourself of everything that's available. I want you to encourage you to go to resolve.org, because we have a lot of content on our website about the medications. What are they? It's under the What Are My Options category of our website. We also have a program called Coverage at Work. This is a program where you can receive a lot of tools and resources to go ask your employer to add these benefits. And I know that sounds very scary, but we're here to support you. We have a Facebook group of people who've done this. We have an employee on our staff who coaches you. We are here to hold your hand. We provide all sorts of information and resources. And then we have a toolkit for employers that basically says this is what a good benefit really looks like. So, Brianna, you mentioned that some of the patients you see have a $3,000 lifetime cap. Like what? If you're at a company that has that, go look at our Coverage at Work program. We need to improve those benefits
Definitely.
in a big way. We also do have a list on our website of grants and scholarships and financial programs. Many of the ones that Brianna mentioned are listed there as well. But really at that point of contact with the pharmacy, do not hesitate to ask what your options are. Brianna, any final words of advice or pearls of wisdom that you'd like to share before we close this out?
Yeah. Don't be afraid to ask questions and just really advocate for yourself. From the pharmacy side of things, we get calls from clinics, physicians, nurses, patients all the time asking questions about, hey, I forgot to put this in the fridge, or I'm not sure what needle to use for this injection, or, how can I make this easier for myself or my patients? And just remembering that we really are, you put it well, a part of the healthcare team and part there to help. My goal is to make this as least amount of stress on you as possible as a patient. You're already going through a lot as it is. And I really don't see any dumb questions. So I always love when patients are calling me anytime they have issues, anytime they, just need to talk something through. Really just being vocal and putting it out there and, just letting this be a process where you are there with others and knowing that you're not alone and that you are, just, you can ask questions and you can just be yourself and be vulnerable and just let others help you through this process.
Wow, fantastic advice. Brianna, I can tell your patients and your colleagues probably love working with you. We are grateful that you spent a little bit of time at the Resolve kitchen table sharing this information. And I want to just thank everyone who's listening. Don't forget, go to resolve.org for any other questions or information you might have. Thanks so much for listening.
Thank you for having me. I really appreciate it.
It's been great having you.